Assalamualaikum and a very good day to Dr. NORAZRIN Binti Mustafa-Udin. We are going to present you on communicating disease patterns and data for workplace health management in the mining and quarry sector for granite workers. There are 5 members in our group.
Hello, let me introduce you to mining and quarry. So, mining is an underground or surface excavation which collect materials such as minerals, metals, coal, and so on. It typically deeper and more extensive compared to quarry. Mining aims to reach resources beneath the Earth's surface. Compared to quarry, quarry is an open excavation or pit that collect materials like stone, rocks, and gravel or other construction materials. Quarry is typically shallow compared to mining. Here you can see the upper side is known as the quarry, where the lower side is mining area. Now, let me introduce you to the occupational disease where our main focus in this study is respiratory problems. Firstly, dust from granite rock crushing can cause a variety of respiratory problems, including silicosis, which is a chronic lung disease that can lead to death. This is because quarry and mining produce a lot of particles such as smoke, fume, toxic gases, and surface vibration. Thus, in the study, more epidemiological and pathological research is needed better to understand the causes of respiratory problem in quarry workers and to develop effective prevention strategies.
Let's take a look at the trend and data for this topic. 66% of the granite quarry workers were aged below 40 years old, with 38% having more than 10 years of working in a quarry. In the comparison group, 52% of the participants were aged below 40 years, with 64% having more than 10 years of working in the office environment. 56% of the granite quarry workers are smokers, while 40% of the administrative workers are smokers. The percentage of ex-smokers from both groups was similar, with 5% of quarry workers and 8% of admin workers respectively. From Table 1, we can see that the most common symptom in the exposed group was phlegm with 46%, while the most common symptom in the comparison group was dyspnea with 38%. There was also no significant difference in respiratory systems between the two groups. From Table 2, we can see that the forced expiratory volume in 1 second, or FEV, for both groups was normal. The grinding bunker had the highest mean respirable dust concentration, being 0.262 mg over cubic meter, which exceeds the permissible exposure limit PEL of 0.10 mg per meter cube for 8 hours working per day. Here are some things that we could conclude from the data provided. The first one is this study suggests that granite quarry workers may be at increased risk of respiratory complaints such as cough, sputum, and dyspnea. Secondly, the study showed that granite quarry workers had significantly lower FEV percentage or FVC than the comparison group, while the FEV and FVC were not statistically different. Thirdly, there is a high prevalence of respiratory systems was found among granite quarry workers, which was attributed to moderate compliance with mask usage, which is 72%. Next, the mean respirable dust quartz levels in the grinding bunker section with 0.52 mg over cubic meter and the premix plant section with 0.22 mg over cubic meter, which exceeded the PEL under the use regulations 2000 of 0.10 mg over meter cubic. In addition, years of working in industry environment add proof that the workplace plays an important role in respiratory impairment by decreasing pulmonary function. Finally, future studies should be conducted in multiple countries and settings to confirm the findings of this study and to identify the factors that contribute to the health risks of quarry work.
Good day, Abi. So I am MARSYA. Today, I will be presenting findings on the high-risk group in our study, focusing on respiratory health outcomes between granite quarry workers and a control group of administrative staff. The comparison group consists of 50 administrative workers from the University Science Malaysia USM Health Campus. This worker was chosen because they work in a non-dusty environment, making them ideal for comparison with quarry workers exposed to respirable dust. Both groups were matched for age, gender, and years of employment, ensuring a fair evaluation of health outcomes. The highest group in this study is the granite quarry workers who were exposed to high level of respirable dust in their occupational environment. This group comprises of 50 male workers from Pulai Condong, Kelantan. So why the quarry workers are the high-risk group? To summarize, the granite quarry workers are identified as a high-risk group due to the following facts. Firstly, constant exposure to fine respirable dust in the quarry environment. Secondly, cumulative effects of prolonged employment, especially among older workers. And thirdly, lack of sufficient protective measures or safety regulation in their working conditions. Now, let's dive into why the granite quarry workers are classified as a high-risk group. Firstly, gender. All participants who were exposed group were male, and their work condition exposed them to high concentration of respirable dust, increasing their vulnerability to respiratory illnesses. Secondly, time of exposure. Workers with longer employment duration had a greater risk of developing chronic respiratory symptoms due to the cumulative effect of inhaling fine dust particles over time. Thirdly, age and employment duration. Older workers and those with extended work period were particularly affected, emphasizing on the long-term health effect of sustained exposure to occupational dust.
Now let's move on to the risk factor. First, chronic exposure to dust. Continuous inhalation of silica dust from crushing granite can lead to serious lung issues like silicosis and cancer. Second, improper use of personal protective equipment. The study found that only 72% of workers use masks regularly, leaving many still exposed to unsafe dust level. Third, poor hygiene practice. The study notes that 36% of workers did not take a shower before going home. This brings dust into their homes and put their family at risk. Another risk factor is age. Older workers are more vulnerable to lung disease since the body's ability to repair itself decreases with age. Lastly, the workplace environment. Quarry environment with stone cutting or crushing equipment produce a lot of dust, particularly when the ventilation is full.
For prevention and control measure, there are two evidence-based strategies stated in order to overcome the health problems in the sector. There are few suggestions for the prevention and control measure in the sector. Firstly, for the workplace monitoring, regularly measure dust levels to ensure compliance with occupational exposure limits. Next, job rotation. We must limit workers' time in high exposure areas to reduce overall exposure. For signage and restricted areas, we must clearly mark high dust areas and restrict access to essential personnel only. For training and awareness, we must educate workers about the hazards of respirable dust and the importance of using controls and protective equipment. For personal protective equipment, PPE, we must provide workers with appropriate respiratory protective equipment such as N95 respirators or equivalent for routine work, powered air purifying respirators (PAPRS) for prolonged or high-risk exposure, ensure proper fit testing, maintenance and regular replacement of PPE. For health surveillance and medical screening, we must conduct pre-employment and periodic medical examinations to monitor workers' respiratory health. Then, we need to monitor workers for early signs of respiratory diseases such as silicosis or chronic obstructive pulmonary disease (COPD), and we must provide access to medical care and treatment for affected workers.
That's all from us. Thank you.